PPI is obviously incredibly important in making sure that the patient voice is to the forefront of any decision-making processes around research. But there are more subtle benefits to it as well that we don't always think about. It really helps the researchers to focus in their planning on what the patient needs are. And it also helps the patients as well to understand the research processes and what's involved in research exactly. And if they understand that, they're just a lot more likely to become involved in research then and to participate, particularly in the case of clinical research.
Public patient involvement is important because it means that you are doing research that matters and doing research that has a greater impact on the people that are involved. I think research is very definitely made better and made easier by the input of people with MS.
If you're involved in a process where you are trying to treat a condition, unless you fully understand what that condition is, then you may not be answering the right question. So you may have a solution, but you may have a solution where there's not actually a problem. So I think it's important to know that the solution you're creating is relevant to the patients who actually have the problem in the first place.
I think patients have a responsibility to let people know what it's like to live with the condition. We shouldn't expect our clinicians and scientists to have all that knowledge and to be able to have all the answers, especially now that we're all living longer and we're having multiple conditions. So we have to step up to the plate.
I think involving patients and the public is really, really important in research because unless the actual research is going to address their issues, the value of the research in terms of improving their quality of life is going to be undermined. I suppose in many ways I come from a clinical nursing background, so my orientation and my whole value set would be very much about making research serve the interests of the public and particularly of the patients that I would be looking after. So that would be a particular value set that I would bring with me, basically coming from my clinical background, but also I'm using it in my research and my research value set.